Hello, this is Sudharshan, and in this episode, we'll talk about chapter 33, that is HIV or AIDS. So, with respect to AIDS, it is nothing but acquired immunodeficiency syndrome, which is caused by HIV, that is human immunovirus. So, with respect to the structure of HIV, so it is basically having two coats are there. So basically we have an envelope consisting of a lipid core with two glycoproteins 120, 120 and 41. And the inner part is going to have obviously an inner core with ssRNA with a reverse transcriptase enzyme and surrounded by the matrix. Then we have some important structural genes present in HIV, that is GAG, POL and ENV gene, GAG, POL, ENV. So ENV gene is more important, that represents the envelope, the GP120 and 41. And the POL gene, that is the reverse transcriptase, protease and integrase enzymes. And whereas the GAG gene is for the core part. Right, and then with the mode of transmission, mainly through sexual route, that is common. Apart from that, other routes like blood transfusion, then from mother to child, fetoplacental unit, then via the skin and mucous membranes, blood spills. Alright, so with respect to pathogenesis, let us have a look. So mainly the HIV will try to enter into the immune system and it will use its GP120 receptor. The GP120 to bind to the CD4 receptor, which is expressed on the helper T cells. So MHC and TCR, that interaction will be there. And it will stimulate the other cells like monocytes, macrophages, astrocytes, etc. And also there is a co-receptor that will help it to gain entry into the host cell. That is, it uses CXCR4 and CCR5. CXCR4 as a X4 strain that is present. And then let us see with respect to the replication. With respect to the replication now, we have first the single-stranded RNA, that is by the enzyme RNA-dependent DNA polymerase. It forms a DNA-RNA hybrid, so both are present. Then digestion, so it is broken down by ribonuclease. It breaks down the ribonucleic acid part of both DNA and RNA, and especially the DNA, so the deoxy part will be removed. We have the single-stranded DNA. Then there is a DNA polymerase, so that will double the DNA. So double-stranded or dsDNA, that enters into the host cell nucleus. Then there is an integrase enzyme, so it is joined this dsDNA with host chromosome. Then the central dog markers, then the mRNA, translation, proteins, and on the other side, it generates viral ssRNA by the host cell polymerase. So basically, this viral proteins along with the ssRNA come together to form the daughter virions. Right, and then with respect to the disease progression, so initially there is an acute disease, that is nothing but the HIV virus has just entered into the system, into the immune system, and then it will destroy the T cells and cause the primary viremia that is there. Then there is asymptomatic stage where the patient doesn't experience any symptoms, and then there is a restoration of the helper T cell count, and the amount of virus in the bloodstream will be decreased. And once the latency is broken, then the disease has a rapid progression which was very fatal. Then we have PGL, that is persistent generalized lymphadenopathy, enlargement of the lymph nodes, which is continuously seen in various sites. Then we have a symptomatic HIV infection, where we see the flu-like illness or the constitutional B symptoms like weight loss, fatigue, malaise and night sweats. And some opportunistic infections like candida, oral thrush, then GI distress might develop. And finally we see the AIDS, where there is more amount of the viremia and also opportunistic infections will develop here. And with respect to the diagnosis, it can be done by the NAT, nucleic acid amplification test can be done. Molecular techniques like ELISA PCR can be used. Testing for CD4 CD8 count ratio can be done. P24 antigen detection can be done. Then immunoassays can be done. Then Western blot assay is done. And most important for the diagnosis of HIV, narco strategy. So basically it uses a series of algorithms for the diagnosis of the HIV infection, where test kits are generally employed. And then finally coming to the treatment, it is done by the HART, highly active antiretroviral therapy. So where we are going to combine two non-nucleotide reverse transcriptase inhibitors with one nucleoside reverse transcriptase inhibitor. So generally post-exposure prophylaxis is given. That is tenofovir and lamivudine, 300 mg, 1 tablet each day, or the protease inhibitors like lopinavir and ritonavir. Lopinavir is given 200 mg, ritonavir is given 50 mg. So different antiretroviral drugs like protease inhibitors, integrase inhibitors, fusion inhibitors, nucleoside reverse transcriptase inhibitors, then non-nucleoside reverse transcriptase inhibitors. So they might be combined accordingly. So that is all with the HIV. So thank you so much. We'll see in the next lesson.